Hello, welcome to this course. I'm going to be going over tips on working with hospitals, a placenta advocacy guide, and really showing you guys or talking to you guys about how to be proactive and informed about the hospital policies that are in your area regarding placenta release. It's really important that you understand the common reasons that placentas are sent to pathology, the parents' legal rights to the placenta, questions to ask care providers, and also tips for working with different hospitals, getting to know their policies, getting to know the staff, and presenting yourself in a professional manner. So let's jump right in. We're going to first go over just some common hospital policies. There are policies that are more common than others in relation to a tissue release. Some hospitals, including the one in my area, require that the placenta be removed from the hospital immediately following the birth. Other hospitals will require a 24 to 48 hour hold and will not release the placenta before their predetermined time frame. In cases like this, the hospital will place the placenta in a labeled container and store it in a designated refrigerator. Occasionally, although this is very uncommon, hospitals will require that all placentas be sent to pathology prior to release. This is very rare, but it does happen on occasion. I've worked in a few hospitals that require ID, contact information, and a signature for release. They have like a little logbook. They keep all that information in. I have to fill it out, my name, signature, all the stuff, date, before they'll actually hand the placenta over to me. Almost all hospitals require that the mother fill out and sign a tissue release form and a liability waiver. They will not let the placenta leave the hospital until the form has been completed. It releases the hospital of liability and puts all the responsibility and liability on the parent, which most parents are happy to take that on. On occasion, a physician may request to send the placenta to pathology. This is not uncommon if there's a suspicion of infection, hemorrhage, placental abnormalities are present, certain pregnancy conditions are present, for example, gestational diabetes or cholestasis, or if the mother is suspected of substance abuse. The mother can request that a small sample be taken from the placenta rather than the entire thing. Typically, only about a quarter-sized piece is actually required for the testing, so they don't need the entire placenta. Ensure that the piece removed does not include the umbilical cord, especially if you're providing stem cell therapy services. This is important for encapsulation and stem cell because we know how nutrient dense the cord is. But so if you can ask or have your client ask, you actually have to have your client do this for you. You cannot ask for them to take just a piece. Your client has to do it. And they also need to ask that the piece is taken while in their hospital room. That placenta should never leave the hospital room unless it's to go to a fridge where they're going to store the placenta for the client. So your client is going to want to ensure that they remove a small piece while in the presence of the client, and that piece not be at the umbilical cord insertion point or part of the umbilical cord. It needs to be near the outer rim of the placenta, kind of near where the amniotic sac is attached. And they don't need a big piece. They don't even need probably a quarter of the placenta. It can be a pretty small piece that they can take just right from the room, and then you know that the client has had visual contact with that placenta since it was delivered. And that's the safest way to do it. That's the only way to know exactly who has handled the placenta, what it's come into contact with, if anything, and to make sure that your client stays safe and that you can stay safe as well. The next thing we're going to talk about is being super prepared. Here are some things you can do to make sure that you're ready and you present yourself professionally when you're at the hospital. You'll want to do a little research and find out what the release policies are for the hospitals in your area if you have more than one. Communicate the applicable policies to your client so that they can also be prepared, and dress professionally. You don't need to wear a pantsuit. You don't need to look all dressy and amazing, but please, whatever you do, please, please, please do not show up in a sloppy t-shirt and jeans or in your pajamas. Look nice, look put together, present yourself as a professional. Wear a name badge, make sure you're carrying your labeled biohazard cooler, and have a generic hospital tissue release form just in case the hospital doesn't have one or your client is wanting an extra, whatever the case may be. It's always good to have those. If you're working with a new hospital or you're not well known among the staff, bring your biologic certificate just to have it handy. It's also very helpful to get to know the staff that you'll be working with. You'll get a really good idea of the nurses and doctors that will make placental retrieval easy and the ones that might make it more of a challenge. I've been working in my area for 5 years. I know exactly which doctors and nurses are going to happily release the placenta, and I know the ones that are going to do it a little bit more begrudgingly. I have a couple doctors in my area that have all but dropped the placenta on the floor just to keep a client from taking it home. I actually only have 2 doctors that have done that. But you also get to build relationships with the staff, the OB staff, and you do develop some wonderful relationships. A lot of these nurses are very open to it. There's a few doctors in my area that are very open to it, and they actually, off the record, will recommend it to their patients. So we are making our way into the hospital world, which is wonderful. It's such a good thing to have that advancement for this field. Know your client's rights. States, as well as individual hospitals, have different policies on tissue retrieval. In the U.S., there are no state laws preventing parents from keeping their placentas. Legally, a hospital can't keep the placenta or send it to pathology if a parent requests otherwise. If a hospital wants to take a placenta to pathology, the parent has every right to refuse or to request a small piece be taken for testing rather than the whole thing, which I mentioned before. The only thing with that is it has to be the client who requests it. You can't barge in there and say, "You're taking that to pathology, you can't do that. You can only take this one piece." You can't do that. As much as we like to be advocates for our clients and we like to fight for them, they have to be the one that initially put their foot down and say, "No, I don't want you to take my placenta to pathology, or you may test it, but please only take this small amount. Do it right here in front of me, and we'll be good." And usually, if you have a parent who's willing to do that, I've actually never had a parent who wasn't willing to do that because these parents want their placentas. They're amazing. Usually, if you have a parent who's willing to do that, the hospital staff will not push back. They'll oblige. They know the law as well. So they're not going to give the client a hard time or make it challenging for them to keep the placenta. So these are just the basic rules for placenta retrieval. A lot of this we're going to go a little bit more in depth with throughout the course, but these are some really good guidelines. I think the most important thing here is to be prepared, be professional, dress professional, be ready, be prepared, and know your hospital. Know the policy, get to know the staff, develop a rapport and a relationship with them. It will just make your business so much smoother. The first 3 years of my business, I didn't have a good relationship with the hospital staff. Part of that was that our hospital is pretty old school, and they weren't open to the idea of placenta retrieval. Nobody was doing it, and so it was weird to them. They didn't like it. Nobody really liked me. I didn't make a lot of friends, but the more I kept doing it, more I kept talking about it, I was a professional. I carried my certificate with me. I wore my name badge. My ice chest has a big old biohazard sticker on the side of it. I mean, I look put together when I go to the hospital, and they view me now more as a professional than just as some hippy-dippy girl coming in to pick up a placenta. So, all that to say, it's important to know all the things. Know your policies, know the laws, inform your client, make sure that they know all of that information as well, and everything will go super smoothly if you just have your ducks in a row and you present yourself as a professional. So hope you enjoyed this lesson, and I hope you took some good notes. Again, feel free to review it. Okay, bye guys.